Good afternoon. I'm Pat Living with the Department of Health and Social Services and your moderator for the COVID-19 update for Wednesday, July 21st. We're joined today by the Minister of Community Services, the Honourable Richard Mostyn, and Yukon's Deputy Chief Medical Officer of Health, Dr. Catherine Elliott. Our sign language interpretation is provided by Kevin Klein and our French language translation by André Boursier. Following our speakers, we will go to the phone lines for questions from reporters and reporters in the room. We will call you by name and you will each have 2 questions. Minister Mostyn.
Pat, and thank you everyone for joining us today on the traditional territories of the Kwalendon First Nation and the Tonquachin Council. It's great to be here this afternoon with Dr. Catherine Elliott, the Acting Chief Medical Officer of Health. This afternoon I'm going to be talking a little bit about vaccinations. We have one of the highest vaccination rates in Canada, in North America, in the world. What Yukon has achieved this year is quite simply incredible. Despite having about as many people as Campbell River, BC, despite being spread across an area almost the size of France, with some of the most formidable terrain and a very hard climate, Yukoners planned and delivered a world-leading vaccination program. Our high vaccination rate makes the Yukon one of the safest jurisdictions in Canada. Indeed, it makes Yukon one of the most safe places in the world. It is something we should celebrate and brag about because almost 80% of us who have chosen to be vaccinated, the Yukon is now the safest place on the planet. For those who have chosen not to be vaccinated, there's peril, sure. But there's also enough vaccine for everyone. I'm happy to report that we are turning the corner on the COVID-19 wave. Our active case count continues to drop. Over the past week, we've seen fewer than 10 cases per day. We now have 60 active cases, and as folks get better, that number shrinks. A month ago, we were seeing 30 people infected with COVID every day. And we had more than 100 active cases. So the trend we're seeing is encouraging. This didn't happen on its own. It happened through a lot of hard work and sacrifice from civil servants from across government and from Yukoners. I want to thank the rapid response teams who traveled to rural Yukon and worked so hard alongside our community partners over the past 6 weeks. I also want to thank people who got tested either because they were in close contact with someone who was positive or because they experienced symptoms themselves. All that testing has cut the number of unvaccinated Yukoners getting sick. And because so many unvaccinated Yukoners have become very ill, we're now seeing people overcome their reluctance to take the jab. As of Monday, 79% of adult Yukoners are fully vaccinated, more than almost anywhere else in North America. And our youth, aged 12 to 17, are quickly catching up to the adults. In just 6 weeks, 59% of them have received 2 doses. Again, this is absolutely phenomenal. Our youth lead the country and most places on the continent. So an overwhelming majority of our citizens are vaccinated. And the minority who aren't can easily get vaccinated and end the nagging worry of catching a horrible and potentially fatal illness. The vaccine is safe, and it will prevent you from getting seriously ill through COVID. And not just you, every single person who steps up to take their shot is helping protect their family, their friends, and their neighbors. I have a constituent, Karen, who's fragile and cannot be vaccinated. She wants the shot, but simply cannot take it. She's exposed and in danger. I thought about Karen when I got my shots. Yeah, I'm fully vaccinated, and I have absolutely no fear of disclosing that personal information. My protection shuts down a vector of infection which protects this woman and the few others in society who cannot accept this wonder of modern science. So take the jab. Take it for Karen and others like her who truly can't take this wondrous medicine. The Whitehorse Clinic is open Tuesday to Friday for everyone 12 and older. Watson Lakes Community Health Center is open Friday and next Friday. Dawson City is also having clinics next week at the Community Health Center on Thursday and Friday. You can find information and book an appointment at Uconn.ca. If, for some reason, you're nervous, talk to your doctor or a community nurse. Or talk to someone who is vaccinated. Look around. 8 out of 10 people you see already have the vaccine and are fine. We have enough vaccines for everyone, as I mentioned earlier, and we are incredibly fortunate to be in that position. There are a lot of places on this planet that don't have that luxury. Bottom line, this medicine is safe, it works, and it is your ticket out of the COVID-19 pandemic. So, what are the variants we keep hearing about? The evidence suggests that with both doses in place, the Moderna and Pfizer vaccine used in the Yukon work well against the variants of concern. Dr. Elliott, Dr. Hanley, and their team are confident the risk of importation of COVID-19 is now low. That low risk, combined with our high vaccination rates, our global leading high vaccination rates, have prompted new recommendations Dr. Elliott will speak to in just a moment. Today, I am pleased to announce we are further easing restrictions under the Civil Emergency Measures Act. As of August 4th, in just 2 weeks, the requirement for individuals to self-isolate upon entry in the territory will be lifted. The requirement to wear masks in indoor public spaces will be lifted. And physical distancing for stand-up and counter service at bars and restaurants will also be lifted. Bars and restaurants can return to full capacity as they were before the pandemic. Limits on social gatherings will remain for the time being, as this continues to be where we're seeing spread occurring. It is also important to continue practicing the Safe Six. Now, we will monitor the situation and watch for case counts to keep decreasing and vaccine rates to keep increasing. As the Premier mentioned last week, if these trends continue, we will be in a position to lift the state of emergency next month. That will mean all the remaining restrictions introduced under the Civil Emergency Measures Act will be lifted, and we can truly begin to move on from this life-changing pandemic. Each and every one of us has a role to play in getting us there. That we have done it for 17 months. We have to get vaccinated, and we have to continue to follow the Safe Six. And that's what we're urging Yuconners to do. As we move out of the Civil Emergency Measures Act into a more normal society, restoring the freedoms that Canadians hold so very dear, we have to take a measure of personal responsibility. If you want to get vaccinated, get vaccinated. If you choose not to get vaccinated, you still have control over your life. You can choose to where you go. You can choose who you associate with and where. Personal responsibility will then shift to individuals. We're all in this together, and we will get through this together. So thank you very much. I'm now going to turn the mic over to Dr. Catherine Elliott. Thank you.
Thank you, Minister Mostyn, and good afternoon, everyone. I want to acknowledge that I'm speaking from the traditional territory of the Kwanlin First Nation and the Uconn Council, and my role with Dr. Hanley is to serve all people in Yukon. It is my pleasure to speak with you today. Dr. Hanley has asked me to be here in his absence, as we have worked closely together throughout this pandemic response and continue to do so in each phase and at each bend along the path. Today, I will be happy to update on the current situation, and along with updates on the path we are on and been on since early June, some good news about our next steps together with COVID-19 and with each other. Today, once again, we are pleased to share that we continue to see a steady decline in the number of people affected by COVID-19 in Yukon. Our daily number of cases has declined since early June and has now stabilized around 3 to 8 diagnoses each day. 3 to 8 people are diagnosed with COVID each day here in Yukon. Our active case count is continuing to drop to a much more manageable level. Since noon yesterday, we've had 7 new cases. 6 of these are in people who were not vaccinated. Locations of these cases have not yet been confirmed. As of yesterday noon, we've had 458 cases confirmed, along with 8 probable cases since the beginning of June. This represents 556 people in Whitehorse and 94 in rural communities, as well as 6 non-Yukoners who were diagnosed here in Yukon. These cases have been either the B117, otherwise known as the Alpha variant, or the P1, otherwise known as the Gamma variant. We have not yet seen the Delta or the Lambda variants, which are currently circulating elsewhere in Canada. Since this outbreak began, 42 people have been hospitalized for COVID-19 and 8 are still in Yukon hospitals, while 13 are in hospitals out of territory. All people in Yukon have sacrificed much over these last 16 months, working together tirelessly to keep ourselves, others, and our communities safe. And we've done a job that is the envy of the country, as Minister Mostyn just spoke to. Even when we can take into consideration the recent outbreak, we are still in a very good position here in Yukon. We've made tremendous strides with our vaccination journey, and we're now entering a phase where we can slowly ease some of our current measures. After so many months, and especially after the past 6 weeks of this outbreak, we're just starting to feel a sense of calm as our daily case count has begun to drop from really significant highs, and some of the ongoing transmission has simmered down. We can't keep our lives on pause for much longer, and as we continue to learn the ways of how COVID-19 targets, how it infects people, how it's transmitted, we have to transition to a time of living with COVID-19. We have seen that although vaccination remains our best efforts against COVID-19 and our best defense, the virus will find a way to work its way into our lives. And I feel in some ways there's been some challenging but useful learnings along the path. As we have said for many weeks, COVID-19 will not be leaving us anytime soon. We must adjust and accept that our lives may be impacted ever so slightly for months and possibly for years to come. Even so, we need to consider the implications if we don't make an active effort to move ahead. Our goal remains and will always be supporting and protecting the health and well-being of all people in Yukon, and this includes gradually returning to a fuller life while living safely with COVID. We will continue to monitor COVID-19 with a watchful eye as new variants of interest and variants of concern appear on our radar. We'll continue to target our public health system on COVID-19. I know and I understand that opening up may cause concern for some who think we need to keep shut down for a very long time. But really, we shouldn't. And we have to learn to rejoin a world where COVID exists, and we must live wisely in this world. When we, as those entrusted with the health of all Yukoners, make recommendations to government, as we have done this week, please know that we have done our background work to know what we are recommending is what is best for the health and well-being of Yukoners. We have completed modeling here in territory locally. We have reviewed the modeling that is done nationally. We stay in close contact and collaboration with our partner colleagues around the world, and particularly with those who are closest to us in British Columbia and Alberta and our northern territories. We have collaborated and we have learned, and we continue to watch and learn. As we have worked hard to keep the precautions in place to protect us, as we begin our transitional period to living with COVID, as these are the most effective precautions and those that have the least adverse impacts. We've carefully taken the time to assess and evaluate the key data and information that offer some explanation to what transpired over the past few weeks, it is clear that vaccination provides a strong barrier against the virus in its many forms. As we evaluate the case data for those who contracted COVID-19, we've been able to ascertain that for the most part, it was unvaccinated and not fully vaccinated individuals who are getting sick. Those who were vaccinated and did acquire COVID likely had good immunity from the vaccine, but had prolonged exposure to the virus, meaning they were more likely household contacts or family members of an unvaccinated person. However, with our high vaccination rate, I can tell you honestly that this outbreak would have been much more devastating had we not been leading the country in vaccination rates. For those who are unvaccinated, we've seen the virus quickly work its way through the vulnerable populations, those who are gathering in unorganized fashion. And it's important that if you are an unvaccinated person who has not yet been vaccinated, that you recognize that your risk does remain. Even if you've had the virus in the past, it is possible that you could be infected by some of the variants of concern. Perhaps that is weeks or months or years after your initial infection. However, having COVID-19 in the past is not the same as being fully vaccinated. We now know all too well that we have a high number of people who are at risk, and if we continue to see vaccination rates increase both in Yukon and across the country, we can continue to strengthen our barrier of protection against this tricky virus through the months to come. As Minister Mostyn announced, the government has accepted the recommendations from the Office of the Chief Medical Health Officer, and effective August 4th, life will become fuller and healthier with the removal requirement for masking in indoor public spaces, no longer need for people to self-isolate when they enter Yukon from the rest of Canada, regardless of their vaccination status, and bars and restaurants will return to their full capacity. We've carefully and thoughtfully considered these recommendations, assessing how we can ensure the risk is properly mitigated as we lift some of the restrictions that have been with us, in some cases for at least a year. For many months and over more than a year, we have wrapped this blanket of protection around Yukon at the border. This blanket is the self-isolation measures for travelers coming into Yukon, whether they're Yukoners or people from away, and the reduction in self-isolation measures for vaccinated and unvaccinated individuals will mark a shifting in this blanket of protection toward those who are most at risk. I feel confident with this recommendation, as we have accounted for all the jurisdictions' current case activity, and we've determined that the overall risk of COVID-19 of coming into the territory at a rapid rate is very unlikely. Across the country, provinces and territories are experiencing low case activity and high vaccination rates. As vaccination rates climb, our importation risk significantly decreases. Our modeling has currently shown that our importation risk is the lowest that it's been in a number of months. Right now, our data shows that the majority of incoming persons, either by air or by land, are indeed returning Yukoners. We anticipate that may change in the coming weeks and months. We continue to strongly encourage testing. And like Minister Mostyn, I'm grateful for those who have come forward and been tested for COVID. And we encourage people to continue to self-monitor for symptoms. We hope that people will have the common sense to not go out, to not go to work or socialize or travel while they're sick, but instead to do the right thing by physically isolating from others and getting tested. The second reduction in measures will be the easing of masking, mandatory masking in all indoor spaces. Masking will no longer be required at indoor public space, including but not limited to indoor gatherings, restaurants and bars, gyms, and recreation centers and personal service establishments. Unless an establishment requests that people wear their masks, it will not be required in the way it has in the past under CIMA. Although this removal of many of the current constrictions is exciting news for some, I strongly recommend that we continue to take those steps to be wise and to be careful. I don't suggest throwing away your mask anytime soon. Masks will remain valuable for quite some time. such as when the flu season arrives or when you are in a setting where other people are vulnerable to severe disease. For example, if you're knowingly in close proximity for a long time of a person who's not vaccinated, your risk of transmitting or contracting the virus might be heightened. In this case, you may feel it's appropriate to wear a mask, and so may the other person. We need to respect these choices. Or as an additional example, during flu season, it'd be beneficial to have a mask on hand to protect yourself where there's a higher rate of influenza infection and illness throughout the community. Now keep in mind, if you're vaccinated, you do have a high degree of protection from the circulating variants. Still, there may be wisdom in wearing a mask some of the time. You might wear it when you are around people who are at risk of severe illness to protect each other. We will choose these things in order to keep each other safe. When in healthcare settings, please follow the guidance that you are given. So the change in restrictions will mean more choice, and with that choice comes the responsibility to take care of each other. As we remove the blanket from the perimeter or outside of Yukon, we each have the responsibility to wrap that blanket around each other and around ourselves for the health of ourselves and those around you. Finally, the last shift in measures applies to bars and restaurants. Alongside the other restrictions, the other lifting of measures, bars and restaurants will be permitted to return to full capacity, meaning physical distancing measures will not be required between tables or in the countertops. Spacing between tables will not be required in the same way it has been, and staff and guests will be able to move freely between tables. Again, this is a place where we need to responsibly use our own blankets to care for each other. It means that we still want to keep our contacts amongst the close people we know, and that we should not be sitting at tables with people who aren't within our close contacts or our friends. And we also don't want to gather in large groups in a communal indoor area, still avoiding those closed spaces and staying with those familiar faces. Although we saw some transmission in a select number of establishments, bars or restaurants were not the primary cause or point of transmission. The overwhelming majority of bars and restaurants for the duration of this pandemic have closely followed the guidance and measures, and others have responded quickly when we've asked them to, and have continued to keep those practices safe. For that reason, we've seen limited transmission and can confidently say that these bars will be relatively low risk when returning to full capacity. Although after a number of transmission events and this surge in cases that we've had since the beginning of June, this news may come unexpected, that we are in a stable condition and we've reached a point where we can continue to move ahead as we adjust to living with COVID-19. We'll need to keep our eyes on this disease for years to come. We will need to keep testing for COVID when symptoms occur. We will maintain strong surveillance and epidemiology to detect new cases and outbreaks, new variants as they come into the territory. We will continue to collaborate with our partners within Yukon and across Canada. And our transition to living with COVID-19 is in its early phases, and it'll continue to progress over the weeks and the months to come. Information regarding these changes will be updated on Uconn.ca early next week. And as Minister Mostyn has said, these changes will not go into effect immediately, so please do be patient and follow the current guidance until August 4th. Let me just repeat that. These changes will not be in effect until August 4th, so please do be patient and continue to follow the current guidance. As always, our biggest learning lesson from these weeks that have gone by, is the importance of immunization. Immunization is our thickest, warmest, strongest, coziest, and most protective blanket. It's the foundation of our approach, and it's critical to our success in the territory. As of July 19th, 79% of Yuconners over the age of 18 are fully vaccinated with 2 doses. That number continues to climb, and we continue to promote uptake in vaccine throughout the Yukon. We'll have more to say on this in the coming weeks, and I must say that I'm very happy to say that our young people, our youth, again, are leading the nation, continuing to step up with 59% of young people fully vaccinated. What our road ahead looks like will be determined by the number of people who receive the vaccination. So again, if you've not yet received your vaccine, please do consider doing so. I can promise you this virus will continue to take any opportunity that is provided to infect many Yukoners as it can. It does so all the easier if you're unvaccinated. The case counts have stabilized, but the risk has not entirely disappeared. I also wanted to let you remember that we do have the tools we need to live safe and healthy lives with COVID-19 and with each other. We have the responsibility to wrap the blanket of safety around ourselves, around our loved ones, and around others in Yukon, including not only those who we know well, but also those who we don't yet know. As we will remove the blanket of protection from the border, we will need to remain close-knit and caring Yukon and use the tools we have to wrap that blanket of safety, health, and well-being around each and every one of us. Thank you. Shoni Than, Gunal Shish, Masi Cho, merci. I'm happy to take any questions.
I'd like to thank you both, Minister Mostyn, Dr. Elliott, and we'll begin with reporters in the room. We'll start with John from CKRW.
Hi, Dr. Elliott. Will people who attend restaurants and bars need to be physically distanced during activities, say dancing at bars that have live music and such? Is that something that will suddenly be allowed once August 4th comes around?
Thank you for the question. The question was around physical distancing, for example, when dancing and having live music. The specific recommendations for each type of setting and activity will come out over the next, 2 weeks. The physical distancing measures that are lifted that we're talking about today have to do with people sitting down on tables, people sitting at the bar. So please do continue to watch Uconn.ca for those pieces.
Do you have a next question, John?
I do, but I'm not entirely certain I'll get an answer. This also plays into restaurants and food-related businesses. Mm-hmm. Servers and staff, will they still have to wear masks coming forward? I know you just said you'll release specific information, but those people encounter hundreds of Yukoners per day, per shift, so I'm wondering if that might be something that's still within the consideration of we should wear a mask.
Our recommendations, I can appreciate you're impatient to know exactly all the details of every piece, and I think it's important, that we do allow the team to assess. In general, masks will not be required in indoor public spaces. What this means is that individuals, businesses, et cetera, may take different means or measures. However, the requirement is removed. People who are staff, who are fully vaccinated, will have very low risk of transmission, and that's the same for patrons.
Thank you. We'll move to Haley, Yukon News.
Thank you. I guess my first question, I'm not sure if it would, well, it's probably for either of you. I'm not sure who best to answer it, but we've gotten some news this week about border reopening and potential, and with that also testing requirements, the need to have a test in advance. I'm wondering if the Yukon government will look to asymptomatic testing or sort of non-essential testing being offered to the population at all going forward?
All right. I'll take the first crack at this. So within the territory itself, we're removing the any need to self-isolate when you come in here. So within the territory, if you're traveling within Canada, and whether you're vaccinated or not, you can come and go in the territory as you please. Federally, I know the Canadian government has just removed. They're going to let vaccinated Americans come into the country. America hasn't reciprocated. We're now in a different phase where Canadians can actually, or Canada will allow Americans in if they're vaccinated, but Canada won't allow, the states rather will not allow Canadians into their borders. As far as the asymptomatic testing goes, we'll have to look at that. The federal borders are under the care and control of the federal government, so we'll have to see what rules they bring into place here. And I'll turn over if Dr. Elliott has any other options. I think I'll defer to her on the medical side for that, if there are any recommendations coming forward.
So the announcement this week about the August 9th border changes is to do with the federal borders. So testing related to that border is not something that we generally control. The control is a federal control. We do look at testing with relation to our borders, and with the risk currently where it's at for importation from the rest of the country, testing is not necessary at our borders.
Do you have a follow-up question, Haley?
I do, yeah. I had one other question. When the Civil Emergency Measures Act is repealed, I'm wondering if that means there's any controls on requiring people who are positive with COVID-19 to self-isolate. Do we have any way of asking or requiring people who test positive to self-isolate after that?
Thanks very much for that, Haley. And the Civil Emergency Measures Act is the tool through which the Yukon government has been able to impose some of these incredible restraints on Canadian society, on Yukon society, and we have not undertaken any of those measures lightly. It is essential that we've said from the very outset that this was a temporary measure, and eventually we will remove the Civil Emergency Measures Act, and the vaccines that we've had Yukoners so generously take. We've got such a good vaccination rate. We're now at the stage where we can withdraw the Civil Emergency Measures Act. When that happens, it'll be up to people to take personal responsibility for their health, just as they had prior to the pandemic. So as leaders, we can, community leaders, mayors, and First Nation chiefs, we just had a call about an hour ago to inform them of the coming changes. There is certainly some concern about these changes, about the removal of the state of emergency, but really, as leaders, we can encourage people to do the right thing, and I believe that's the message that Dr. Elliott has been giving this afternoon, as have I. We want to make sure that people take personal responsibility for their own health. Just because the government is no longer ordering that people wear masks doesn't mean to say that people shouldn't wear masks. They can take the personal responsibilities they have in societies around the world long before this pandemic had to wear masks when appropriate, and we encourage Yukoners to do that. Just because we're saying you can't gather in groups larger than 6, doesn't mean to say that people can't still limit their social exposures if they feel like they might be at risk. And so they can still do those things. It just won't be enforced by the government anymore. It'll be on it'll be on your own recognizance, your own sense of safety and sense of responsibility to yourself and to your fellow Yukoners. So I guess that's there's a lot to that answer. The bottom line is we are looking at legislation in the territory all the time to see how it can be strengthened. But at this time, when the Civil Emergency Measures Act comes off, if people are ill, it'll be up to them and through public health, just like you were when you're sick before, to stay home, not go to work, not expose other people to the illness that afflicts you, whether that's the flu or tuberculosis or, in some cases, in this case, COVID. You know, if you're sick, get tested. If you don't want to put others at risk, so stay home and self-isolate. There will be people, of course, who don't take that responsibility and who act out, and it'll be up to society to try to force corrections in behavior.
Thank you.
To build on what Minister Mostyn has said, with the lifting of the Civil Emergency Measures Act and the civil emergency, we will no longer have the tool to place restrictions on people in the same way that we have in general. However, the medical officers of health have another additional tool, which is called the Public Health and Safety Act. And under that act, there are certain pieces that we can enforce in order to prevent the spread of communicable diseases such as COVID, tuberculosis, and a number of others. When we talk about enforcement, the first piece of there's really different steps to that, and the very first step is education. So the first piece is around educating society at large and individuals who are infected in the best way to keep themselves and others safe. If people still struggle, we look at supports. How do we support people to prevent transmission or harms from their infection? If the supports and education do not work, and this happens very rarely, we move towards the demonstration that we can enforce certain restrictions of rights in order to keep society safe. And indeed, we have enforced those in the past, and will continue to when we get to that very small fraction of people who require that tool. We do have methods in place to do that, and we have that continuum to ensure that people who are infected with reportable communicable diseases do not cause widespread transmission. Thank you.
Thank you. We'll move now to the phone lines, and we'll go to Hina, Canadian Press.
Hi. I was wondering if you can tell me what the difference, or why is it that you're still enforcing restrictions on the number of people gathered outside while the number of people in bars and restaurants is going to be at full capacity? Why that difference, and how are you going to enforce that kind of a thing?
Sure, I can start. We've really focused, we're at a time now where we need to focus and target our efforts on where we're seeing transmission occurring from person to person. We are seeing this transmission occurring in unorganized gatherings, and where there are large organized gatherings, if the plans are not followed, the rules are not followed, we will see spread to a potentially large number of people. While we do have case count numbers and contact numbers that are manageable, if we had a very large gathering with a widespread transmission of COVID, this has potential again to push our system to capacity. And that's really important that we do everything we can not to get to that point. We have worked with people who are organizing gatherings to support them to keep these gatherings safe, and yet at the same time, this is the place where transmission can occur to large numbers of people, and this is why this is one of the restrictions that we're recommending we hold on to just a little bit longer while we are able to lift those restrictions in places and ways where we're not seeing transmission. Again, in bars and restaurants, we are not seeing transmission. The plans are being closely adhered to, and people are doing the right thing. And so long as that continues to be the way, we recommend that full capacity is the way to go.
Thank you. I'll just pick up a little bit on that for you, on that answer, Hina. Thanks for the question. In this last wave that we endured for the last 6 weeks or so, it has been unorganized social gatherings that has driven this infection among unvaccinated Yukoners for the most part. And those are not controlled areas. They're people where there's alcohol, there's people aren't following the Safe 6, they aren't wearing masks, and they're engaging in dangerous behavior. When it comes to bars and restaurants, those are controlled areas, as Dr. Elliott has just said. They have lists of people who are attending their establishment. It's a controlled. We're not seeing an awful lot of outbreaks there. It's been through basically home parties that have gotten out of hand, and people have let their guard down and basically whooped it up. And so we've got, that's where a lot of the transmission has happened. And so we're going to keep the controls on those gatherings for a few more weeks. And we're going to gauge behavior and outcomes, how the pandemic is, how the wave goes, how many cases we have, while we contemplate new measures, the lifting of the state of emergency. While the state of emergency exists, we do have the ability to actually follow up and fine and take action on people who do not follow the rules that we put in place. So those rules still exist under the SEMA order. So we will have enforcement capabilities until the state of emergency is lifted.
Thank you, Minister Mostyn. Hina, do you have a second question?
I do. I was wondering about, you talked about Yukon having the highest vaccination rate in the world. I was wondering how you calculated those numbers, how you came up with that figure. Thank you for this.
Yeah. No, I thank you for the question. I think I said it was among the highest in the world. I think with that caveat, I think we've accomplished amazing things for a very, very small jurisdiction spread over a very large area. It's been our Yukon crews, our Yukon nurses and health officials. I said nurses. We have people from across the Yukon government who have participated in these teams of people who've gone out through the territory in the depths of winter to very, very far-flung little communities and encouraged and held clinics, taking time out of time away from their families, traveling enormous distances to make sure that this vaccine rollout happened and that we got the numbers. It is really an extraordinary story that happened over the last, most of it over the winter, and now again in these last 6 weeks, at the tail end of a pandemic when everybody was frankly exhausted. And so they rallied and they stepped up again to deal with the worst outbreak we've seen throughout this pandemic. And it happened when everybody was really just starting to hope for the best, and then they got hit with this new wave. Again, an incredible effort on the parts of civil servants throughout the government who stepped up, and of course Yukoners themselves who stepped forward and got vaccinated. The numbers we're seeing right now are 79% of our adult population have double dose. They're fully vaccinated, and those numbers are climbing. Amongst our youth, it's 59% fully vaccinated. That's 2 doses. And looking around certainly across the country, you look at North America, those numbers are very, very high. They certainly are higher than most other jurisdictions in this country, if not all. And they're certainly, if you go to nations of the world and look at their vaccination rates, and admittedly I'm comparing a small province to nations, but the reality is that those vaccination rates that I've cited rank among the highest in the world, registered in the world. And I think when I look at what we accomplished for such a small jurisdiction, under formidable climate, under a huge geography that's widely disparate across a very, very large area, what we accomplished up here is simply amazing and really should be chronicled because it's an incredible story.
Thank you very much. We'll move now to Tim, Whitehorse Star.
Yes, hello, can you hear me?
Yes, we can. Go ahead, please, Tim.
Okay. My first question is to either the Minister or Dr. Elliott. With such a rapid change of restrictions that you're bringing in, do you have any plans on helping people who might find this a little bit overwhelming or perhaps even traumatic to deal with all these changes? Are there going to be services, educational campaigns, anything like that? Is that something you have considered?
I'll start, I think, if I may. You're seeing it right now, Tim. We got this recommendation late Monday afternoon. Cabinet held an emergency cabinet meeting to assess the recommendations coming out of the Chief Medical Officer's Health. We gathered, we had talked about the implications of this and took action, which is implementing the recommendations of the Chief Medical Officer of Health in 2 weeks' time. That 2 weeks' time, that delay to the 4th of August, allows us to assess how the pandemic is going over the next 2 weeks, and also to reach out to our partners throughout society and explain what's happening and what's going on. We held this meeting now to start to communicate those decisions that were made just within the last 24 hours. And also we've met with chiefs and community leaders across the territory. I believe there are more than 40 people on that call to explain what was happening and to hear their questions and to follow up with them. So as far as the citizens of this territory, they're hearing this for the first time. They will be able to reach out to any of their MLAs, to health authorities, to their doctors, to their friends to discuss it. I'm sure they're going to do that. It is a shift for sure. It is one we're seeing throughout the world right now as the vaccination rates across the country, very few of which are as high as ours, but as these jurisdictions look at what's happening and assess the freedoms of their citizens, they are pulling these safety measures that have been put in place for about 17 months away and allowing people to begin to live their lives and take personal responsibility for their health, much as they did before this pandemic hit. And we're able to do that simply because we have vaccines. These are absolutely amazing. It's amazing medicine. It has been, they've been tested in hundreds of millions, if not billions of arms. They are safe, they work. Certainly when you get 2 doses in you, they render you much better protected against this virus that has only been on the planet for less than 2 years, and they work. And so with that protection, with all that we've learned about this virus, with the Safe 6 and the other things we've got, we feel that society is ready to handle this next stage. And I think I would believe that a majority of Yukoners, more than 80% who have already been vaccinated, support that.
Thank you. If I might build upon what Minister Mostyn said. Thank you, Minister Mostyn, for those important comments. I think I want to be really clear on this one. The change and easing of these restrictions is something that Dr. Hanley and I and the team that we've worked together with throughout the pandemic feel confident is in the best interest of the health and safety of all people in Yukon. This is not a recommendation to party. In fact, some types of partying has contributed significantly to the case counts that we have seen. This is a call to responsibility and for each of us to use the tools that we have to wrap a blanket of safety around each person and each group in Yukon who needs extra support, who's at risk for various reasons, including those people who are not vaccinated yet, to work together and care for all people in Yukon. There are a lot of people who are very used to the restrictions and living in a society with considerable restrictions. Many of us have had to become used to these in order to function in our day-to-day lives in a way that's different than we did before the pandemic touched our shores. I think there will be a cognitive shift required. There will be some people who feel more frightened perhaps or afraid, and I urge you, if you're one of those people, to reach out to your friends, to your family, to talk to your healthcare providers, to call the health lines, and to reach out for the supports that do exist and are here. There are other people who are ready to take that call to responsibility, who indeed have done it over and over again throughout the pandemic and are ready to take that next step to care for each other and be wise in our choices as we move forward to live with COVID. I think we all are ready for this, and we need to help each other and hold the hands of those who are more at risk and the hands of those who might be a little more slower to ease their own restrictions. That includes supporting people and respecting people who choose to keep a distance or wear a mask or keep their contact rings small. It's about respect and caring for each of us and a real call for each of us to use the blankets we have and our responsibility. Thank you.
Thank you. Do you have a second question, Tim?
Yes, I do. This will be for the minister. Does the Yukon government have any plans on getting more involved in lobbying for a full border opening? Lots of Yukoners are ready and raring to go to Haines and Skagway and other parts of Alaska.
Mm-hmm. I know the Premier has been in touch with Mr. Dunleavy over in Alaska, who is also supportive of easing the restrictions, the border restrictions. The federal government, of course, has taken steps and will be allowing vaccinated Americans into the country safely. We are working. I know that the U.S. federal government right now is a holdout. They're looking at their society, and they do not want to open up the border to Canadians at this time. So they've actually just as today, I believe, announced that they're going to keep the border restrictions they have in place until the 21st of August. Right now, that's what it's been extended to. So, of course, I know the Premier is lobbying his American counterparts. I know we are in touch with the federal government. I know they are lobbying to start the transborder trade and travel going. But right now, the Biden administration has decided to keep those restrictions in place. They're looking at their needs within their country, and they will take action when they deem it's appropriate, just like our federal government has.
Thank you. On va maintenant passer à Claudienne, Radio-Canada.
Oui, merci. Donc, Dr. Elliott, en français, pouvez-vous me dire quelles règles demeurent le 4 août? Donc, on a entendu celles que vous abandonnez, mais quelles sont celles qui vont demeurer?
So, Dr. Elliott, could you please explain in French which of the restrictions are going to stay in place on August 4th? You talked about those that will be removed, but what are those that will stay in place?
Merci beaucoup pour la question. Les restrictions qui se demeurent après le 4 août sont ceux qui sont au sujet des gens qui assemblent ensemble, au sujet des assemblements dans les maisons ou bien ceux qui sont organisés et même ceux qui sont dehors. L'exactement règlements sont sur le Uconn.ca pour voir l'exactement précises mesures qui se restent. Merci.
I won't ask you to repeat. You've already given that in English. Avez-vous une autre question, Claudienne?
Oui, possible de me dire donc ce que vous dites, comment vous justifiez votre décision à ceux qui trouveraient que c'est encore trop rapide que de délaisser, par exemple, la quarantaine, d'autant que ce sont les Américains qui pourront éventuellement entrer également. Qu'est-ce que vous dites aux gens qui s'inquiètent?
So could you please give us some indications of your reasoning on lifting these restrictions, given that what is going to come is probably a lot of tourists from the United States coming in? What are your reasoning to propose the lifting of these restrictions at this time?
Merci, Claudienne, pour la question. On accepte chaque fois qu'on change les règlements qu'il y en a des gens qui sont prêts ou bien des gens qui pensent que c'est trop en retard. Et on a des autres gens qui ne sont pas prêts, qui sont peur au changement et qui s'ajustent plus lentement. C'est très important maintenant qu'on respecte tous ces gens, même si qui qui font le choix de porter leur masque, ceux qui prennent la distance physique, et même ceux qui pensent qu'ils veulent faire un type de quarantaine sans une régulation qui impose ça. Je veux être très clair que les recommandations du Bureau des chefs de santé publique, c'est de arrêter la quarantaine pour ceux qui viennent dedans le Canada, qui viennent des autres provinces ou bien du territoire, qui viennent à Yukon, même ceux qui sont des Yukonais, même ceux qui viennent d'ailleurs dans le Canada. De ne pas doivent faire une quarantaine s'ils sont complètement vaccinés ou même s'ils ne sont pas vaccinés. Et on a décidé ça après faire des modèles mathématiques et aussi voir des leçons qu'on a appréciées de nos voisins et bien ici à Yukon. Et ce qu'on trouve dans cette analyse, que le risque de quelqu'un venant à Yukon avec l'infection de COVID-19, c'est très bas. C'est le plus bas qu'il était dans les derniers mois, et bien c'est entre le plus bas qu'il était pendant la pandémie. Cette recommandation, c'est pas au sujet des gens qui viennent des États-Unis ou d'ailleurs, hors du Canada. Et ça, c'est important de savoir. Pour ceux qui pensent que c'est trop rapide, ils ont même le choix de se protéger avec les outils qu'on sait qui marchent bien, comme j'ai déjà dit, mais bien encore prendre la distance physique, porter un masque, etc. Merci.
Thank you. I'd like to thank everyone for their time today. The next COVID-19 update will take place on Wednesday, July 30th at 10:30 a.m.